So in this second video on our series on hypersensitivity reactions, we'll be looking at type 2 hypersensitivity. Just to remind ourselves of the classification of hypersensitivity reactions, as we know there are 4 types, types 1 to 4, and today we'll be looking at type 2. Here's our case: a 23-year-old female who had a postpartum hemorrhage 4 weeks ago, for which she required quite a large transfusion. She had a reaction to this transfusion at the time, but now she's complaining of shortness of breath on exertion and looks pale and mildly jaundiced. So pause the video, see if you can work out what's going on with this patient, and then try to tie it in with type 2 hypersensitivity, and also see if you can figure out a little bit about what type 2 hypersensitivity is, its pathophysiology, clinical features, and treatment. Okay, so type 2 hypersensitivity is an IgG or IgM antibody-mediated immune reaction directed against the host's cellular or extracellular matrix antigens. And you can see examples of this in transfusion reactions, drug hypersensitivity, hemolytic anemia, so such as autoimmune hemolytic anemia, immune thrombocytopenia, rheumatic fever, and Goodpasture syndrome. There are 3 main mechanisms of injury. So antibodies bind to cell surface receptors and may alter their activity. There may be activation of the complement pathway with depletion of complement levels and activation of various other inflammatory mediators. Or there may be cellular cytotoxicity caused by the binding of the antibodies to targeted cells. This can lead to cell destruction without inflammation, or inflammation mediated by complement, as we discussed, or by the Fc receptors on the antibodies, or cellular dysfunction brought about by the binding of antibodies to cell receptors, which may upregulate or downregulate those receptors. How do we treat this condition? Well, the first step in treating type 2 hypersensitivity is to remove the inciting trigger. And remember, these may be drugs, infectious agents, or blood and blood products, as well as other allergens. But it's really important to remove the inciting agent so we can stop the cause of the problem. Beyond this, we need to figure out how to suppress the immune system, and this can be done through the use of corticosteroids, or in some cases using other immune suppressants such as azathioprine or cyclophosphamide. Finally, we may use other types of immune modulation, plasma exchange to remove the offending immunoglobulins from the serum, use of intravenous immunoglobulin, which can actually bind the host's antibodies and take them out of circulation. And in some situations, for example with myasthenia gravis, the patient may undergo thymectomy to remove the source of production of the offending antibodies. So that was our short talk on type 2 hypersensitivity. If you have any questions, you can bring them up in class. I would strongly urge that, having listened to this very short talk, you take the opportunity to read up type 2 hypersensitivity in much greater detail. So in our first 2 talks, we covered type 1 and type 2 hypersensitivity. We'll now move on to type 3 or immune complex and type 4 cell-mediated hypersensitivity in the last two talks. Thank you very much.